Good evening. Some of the victims of the worst scandal in the history of the NHS have been giving evidence at a public inquiry. The inquiry is looking at how thousands of people were given contaminated blood products in the 1970s and 1980s. Almost 5,000 NHS patients contracted HIV or hepatitis C after receiving products that were infected, including those who'd had transfusions after an operation or after childbirth. Of those, around 3,000 have since died, but tens of thousands of others may still be living with undiagnosed conditions. And the inquiry comes after decades of campaigning by patients and by their families, who say that there's been a major cover-up. Our health editor, Hugh Pym, has the story.
A poignant memorial to victims of the infected blood scandal, messages left by some of their families. It'll travel around the country as this public inquiry gathers evidence. At the heart of it are people, infected and affected. They would come first and last, said the judge chairing the inquiry. People like Derek, a haemophiliac. Supported by his wife and son, he explained how he first learned he had HIV.
I was told I had about a year to live. I was told not to tell anybody, including my family.
With his son at his side, Derek talked about his brother, also a haemophiliac who developed AIDS, and recalled the time his brother wanted to talk about his fears.
But I couldn't. It was too close to home for me, and I wasn't there for him. I wasn't there for him. And 3 months later, he died. It's the biggest regret of my life because he's gone and I can't do anything to make amends for that.
Nearly 10 million pages of official documents are being searched as the inquiry tries to find out whether there was a high-level cover-up. Some victims have only recently discovered they were infected.
So for 30 years you were unaware that you had hepatitis C?
Indeed.
Carol only found out 2 years ago she was infected with hepatitis C after a blood transfusion. She said the NHS now had a major task in treating others like her who didn't know they'd been infected.
And the fact that there are thousands of people out there who, like me, didn't have the least idea that they got hepatitis C, and there may be a whole wave of more work coming from that.
Looking this way, thank you.
For Perry, it's the support of his wife and family which has kept him going.
Towards me, thank you.
There is a huge impact on family because they carry you, and but the focus is always on the patient, the person who's suffering. But I know that I won't be here without friends and family.
Victims have been calling for more financial support. In Scotland, some can get around £37,000 a year from official funds, but the equivalent in the rest of the UK is nearly £15,000 less. Today, hours before the inquiry, the government at Westminster announced higher funding, but campaigners say it's too soon to say what that'll mean in practice. In some other countries, full compensation's been paid. Officials have been taken to court. Only now, more than 3 decades on, is the UK mounting a full public inquiry. Campaigners hope it will get to the truth.
And Hugh is with me now. The strength of the testimony speaks for itself, Hugh, really, doesn't it? What does this stage of this inquiry now, and today, what does this signify?
Well, Hugh, it's a very big moment. Yes, we had preliminary hearings last September, but today saw the official launch of this judge-led public inquiry gathering evidence, and you could see how relieved people affected by it were when they came along today. The UK is well behind other countries affected by all this. France, Italy and Japan, for example, have put people on trial, officials and politicians. In Ireland and Canada, compensation has been paid out. Nothing like that has happened here. Yes, there have been financial subsistence payments, but never any finding of fault. And compensation, say, for the loss of a loved one, compensation for the loss of earnings over a lifetime. And that's where this inquiry may eventually get to, with its power to pull in documents, millions of them from around Whitehall, the Department of Health, going back years, the power to compel witnesses to give evidence. And yes, politicians, secretaries of state, former ministers from all these years going back will be asked to give evidence next year sometime. No wonder it's been called the UK's biggest ever public inquiry.
Hugh, many thanks again. Hugh Pym there for us, our health editor.